Those few are are self-explanatory, and I'd like you to focus here on variety. She says that a person, okay, would be of not in good health if there would be no stimulus, no variety. Why? Again, remember that Florence Nightingale's work was outward, and mostly those patients who are sick or currently don't have any stimulus at all. All they see is tent, all they see is sick people. She said that you have, as a nurse, you have to talk to your patient during your rounds so that they will be eased, or their reparative powers would be improved. Now, shattering hopes is also part of the environment. What's this shattering hopes? This is the inner power or the inner psychological power of every individual. She says that if this shattering power of the environment would have a problem, it's the nurse who would have to look at it. Okay? Again, you will be noticing that this environment belongs to the whole environment of the nurse. It means to say that the nurse should be the one controlling the environment if and when the client has no reparative powers. Okay? Now we're done with Florence Nightingale, and I would like to describe how Florence Nightingale, or how the contribution of Florence Nightingale was very evident in our nursing world. Again, I would love to describe it as a pendulum wherein the nursing profession, or the focus of the nursing profession is actually moving. Now, during the time of Florence Nightingale, since it's the environment or it's the patient with a very sick condition, the focus of the work of Florence Nightingale was very much disease-centered. Okay? Apparently, this focus is not the way we see patients right now, because for her, patients are those who are sick. Okay? Nowadays, we don't look patients as those who are sick only, but we see the holistic view of a patient. During her time, Florence Nightingale, nursing work was focused on the disease. Okay, let's now look with another theory we call Virginia Henderson. Now, Virginia Henderson is a product of a very pronounced, or a very well-known university that produced several of our nursing theories. That's Columbia University. And for Virginia Henderson, her works was committed to teaching. It was evident as the earliest 1924 at Teachers College at Columbia University, Yale University, and as a research associate. Now, this and other works belong to the great curriculum, or to the great professional contributions of Virginia Henderson. Okay, there was a very great definition of Virginia Henderson about nursing. She said, nursing is temporarily the conscious of the unconscious, the love of life for the suicidal, the leg of the amputee, the eyes of the newly blind, a means of locomotion for the infant, knowledge and confidence for the young mother, the mouth for those who are too weak to withdraw to speak, and so on. Meaning to say, the value of nursing profession is very put into practice. Okay? Now, aside from the work of Florence Nightingale, during the time of Virginia Henderson, she made mention of how important nursing work is. Okay? To be able to do that, Virginia Henderson provided us with 14 basic needs of the patient. Okay? Meaning to say, these are the things that we will be doing for the patient. As she have mentioned, we are the consciousness of the unconscious, the eyes of the newly blind. Okay? We should be looking at the needs of the patient to be able to be the nurse. Okay? And for us to be able to do that, we should be looking at these 14 basic needs. Now, these 14 basic needs comprise of the normal breathing pattern, adequate eating or adequate drinking, elimination of body waste, desirable movements and positions, the sleep and rest, and so on. As we are looking into it, we are very much familiar with this because basically these are the current goals of our nursing work. Okay? Now, upon the arrival of the theory of Virginia Henderson, there was a shift of our nursing theories, or there was a shift in the focus of our nursing theories. So there was a shift in the focus of our nursing profession. From disease-centered, we are now looking at a profession that is patient-centered. Why? Because it's the patient that we will be looking upon, not basically the nurse. Okay? We will be looking upon, first and foremost, the needs of our patients. Okay, after Virginia Henderson, who have presented with us the 14 basic needs of nursing, we now go on to her predecessor, whose name is Faye Abdella. Abdella's focus as a theorist initially focused on the lack of scientific knowledge that is unique to nursing. Okay? Basically, on the time of Florence Nightingale and the time of Virginia Henderson, there were lack of scientific or professional backgrounds of nursing. During that time of Faye Abdella, she was able to make mention of the scientific concerns of nursing so that it would be a very strong profession later on. Okay, there was evaluation of students' clinical experience are based on service approach provided no measure of the quality of the experience, and the delivery of care to the patient must be organized around meeting the needs of the institution rather than the needs of the patient. Now, basically, these are the three problems that Virginia Henderson saw. Now, with that, she was able to develop for us a list of 21 nursing problems. These are conditions presented or faced by the patient or the family. Okay, problems are subdivided into three categories, that is the physical, the social, and the emotional. There must be the nurse must be a good problem solver. Now, as we have been mentioning a while ago, during the time of Virginia Henderson, the nursing work was not on the scientific process, but on the caring aspect. Basically, you would want, on Virginia Henderson's time, basically you would want to know the problem of the patient and provide a solution with that. For Faye Abdella, it's quite different because for Faye Abdella, okay, the value of the nursing process was very evident. Okay, for her, the nurse must be a good problem solver before you will be able to create or to give your patient his or her 14 basic needs. Now, basically, this is another breakthrough of our profession. From the patient-centered profession of nursing, we are now going to shift on the nurse-centered profession. Now, as a pendulum, again, the behavior of a pendulum it's not constant, it moves. Now, during the time of Faye Abdella, the nursing world or the nursing profession was already completed. We have a disease-centered profession, at the same time, a patient-centered profession, at the same time, a nurse-centered profession. Here is the 21 nursing problem that is divided into physical, social, and environmental concepts. Faye Abdella gave us the 21 nursing problem to guide us on how we will be developing our care for the patient. Now, if you are doing NCPs, if you are doing your charting, and you are doing the NANDA typology of nursing problems, we are actually looking at the first NANDA. We are actually looking at how it was first developed. It was Faye Abdella who gave us a structural component or skeletal component and how we will be doing nursing care for our patients. Okay, after Faye Abdella, here now goes a New Yorker in the name of Lydia Hall. Lydia Hall's work basically focused on the core, the care, and the cure. Let's first discuss about the core. Okay, the core is the person which has social sciences or therapeutic use of self aspect of nursing care, or the core. Meaning to say, these are the three strategies that the nurse should be using in taking care of the patient. Okay, the core, meaning to say, it's the personality of the patient. It's how the patient will be able to use his or her own self or the therapeutic use of self. The therapeutic use of self was first presented or was first identified by Lydia Hall. But later on, as we go along with our psychiatric nursing with Joyce Travelby, okay, and Hildegard Peplau, we will now see that Lydia Hall's therapeutic use of self was the first instance we are trying to develop, or we are looking at how to take care of individuals in the psychiatric setting. Now, the body has the natural and biological science, intimate bodily care, or aspects of nursing. Now, on this type, the nurse will be using her own body, her own hands, to take care of the person. Okay? And lastly, the disease, the cure. Okay? The nurse must be able to know the pathological and therapeutic sciences seeing the patient and the family through medical care aspect of the nursing cure. Now, all these factors go on the specific levels wherein they are overlapping. If you could see the concept of the core, the care, and the cure, there are spaces where